I'm Sister Victoria Black of Protea Nursing Services. I am an independent midwife in South Africa, and today we're going to be talking about vaginal birth after caesarean section, or more commonly known as a VBAC. Now you might ask, what is a VBAC? A VBAC is when a mum has previously delivered via a caesarean section with one of her births, and she's now trying again for a natural birth. Within the birthing community, we refer to that as a trial of labour after caesarean section. So when considering a mum for a VBAC, there are certain safety criteria that we would consider to ensure the safety of the process. One of the first things and the most important things is we would consider the gap between pregnancies. So that is from your caesarean section birth until the pregnancy where you're at now. Usually that gap should be about 18 months. That gives your uterus enough time to heal and rest to be able to take the strain of pregnancy and birth. The next thing that we would look at that's also quite important is the indication for your previous caesarean section. Now, sometimes women have elective caesareans or emergency caesarean sections. Some of those indications may be things that could repeat itself in subsequent pregnancies where others do not. That's also an important criteria to consider when you are planning for a VBAC, especially in the case where things might repeat itself, so that you can adequately prepare yourself in case of an emergency. The third thing that we would usually monitor quite closely is the size of the baby. At the beginning of pregnancy, your midwife or obstetrician would usually refer you to a dietitian so that you will follow a healthy, balanced diet during your pregnancy. In the modern day, we have poor diets and we resort to easy food, and often they are filled with empty calories and they are incredibly processed foods, which are actually quite unhealthy during pregnancy and may contribute to a condition called gestational diabetes. Although we know that this condition also has genetic links, it's more often as a result of our lifestyle during pregnancy as well. The fourth thing that we would consider is the health of the scar during the pregnancy. This is something that we would routinely monitor with your ultrasounds that you would either do with a sonographer or your backup obstetrician that you have chosen to go with during your pregnancy. Another thing that we would consider as well is how many babies do you have in your uterus. If you are having a multiple pregnancy, such as twins or triplets, within the South African context, you would not be able to find someone who would back you for a VBAC birth. Ideally, there should be one baby in the uterus. Closer to the time of the birth, we would also start to monitor the presentation and the position of baby more closely, as this may also have an impact on the likelihood of you having a caesarean section or having a VBAC. The reason why this is important is ideally we would like to have baby facing head down in an occipito-anterior position. Another thing that's also incredibly important that we monitor closer to the time of the birth is actually the length of the umbilical cord, which we can sometimes roughly estimate with ultrasound, although it is not entirely accurate. When your cord is incredibly short, it may prevent baby from actually descending into the birth canal during the birthing process, and you may end up with a repeat caesarean section. During labour itself as well, we monitor your contractions. As a VBAC client or a trial of labour, you cannot receive any of the oxytocin-based augmentation drugs that we could give to someone who does not have a scarred uterus. So if you are experiencing weak or irregular contractions during the labouring process, we may be limited in how we can manage that. As a midwife, we would employ natural and non-invasive techniques, such as encouraging mom to walk and move about to encourage those contractions. Something that ties in quite closely with contractions is also the rupturing of membranes. Often if moms rupture membranes prior to going into labour, That would also impact on the strength of their contractions and the duration of their labor, and may also alter the success and the safety of the labor itself, as the moment the waters break, you do get put on a bit of a clock due to the risk of infection to both yourself and baby. The last thing that we would also consider for a mom trying a VBAC is if there is any history of trauma or bleeding during the pregnancy itself, as this may be an indication that there is a weakened scar, and that we should very closely monitor that mom during labor if she is still a candidate for a trial of labor. In terms of risk, and I think this is the biggest question I always receive from parents during the pregnancy who are planning on having a VBAC, is what is the risk of severe complications happening, and what can I do to manage those complications? And I will always say to my parents, prevention is better than cure. But your risk of severe complication, and I think the biggest complication that people often refer to is that of uterine rupture. So that is where, because the scar is a weakened part of the uterus will then tear. Now, your actual risk for that occurring during the labouring process itself is about 1%, especially if you have no underlying medical conditions such as infection or trauma or severe contractions. For the pregnancy, as the uterus is growing in size and as the baby is growing, your risk is actually far greater, and they usually plot it through research between 10 to 13%. The reason for that is, during the pregnancy, as the uterus is stretching, there is actually more strain put on the scar than during the labouring process itself. And that's why we do not use oxytocin-based drugs during the labouring process with a mum who has a scarred uterus, because that would greatly increase her risk of having a uterine rupture. In terms of other complications that you may experience during a VBAC, those are the normal complications that you would have with any natural birth, and those are risks either to you or to baby. But according to the World Health Organization, of all births that occur, only 15% of those total births would have some kind of complication, and an even lesser percentage would have a serious complication. When we talk about a VBAC versus a repeat caesarean section, which is again another question that's often asked during consultations, parents would like to know, why shouldn't I just book myself in for another caesarean section? Why should I be trying for a trial of labour? Now, my answer would normally be that it is still the best for your body to give natural birth, and it has the least impact on all your organ systems. When you are doing a caesarean section, and I think that's a fact that's often overlooked, is it is a major abdominal surgery where we cut through all the layers from skin down to organ to be able to get to baby. And we know that with any major operation, there are serious risks that you run, and with each caesarean section, the percentage of that risk actually increases. Now, some of the more common complications that you may experience with repeat caesarean sections is you have a higher risk of bleeding. There's usually a higher risk of scar tissue forming, which can impact the normal functioning of your organ systems. And of course, there is that risk of infection, which is something that you could have with any operation out there. I often say to parents, if someone were to cut into your chest today to do a heart operation, you'd take a step back and say, whoa, I need to get a second opinion. And when it comes to caesarean section, which is also a major operation, we often just say, yes, please sign my life away, without ever asking why. Is this the best route to go? And I'm not pushing a specific agenda to go one way or the other, because caesarean section is still a helpful tool and it's there to save lives, but it should be used for that. When you talk about the benefits of having a VBAC, you have a shorter recovery time. The impact on the body is far less because you do not create a big wound or you run the risk of scar tissue. You have lesser bleeding. It promotes the rate of breastfeeding, and the benefits of breastfeeding to mom and baby are greatly beneficial both in the short term as well as the long term. And it also increases bonding, family bonding, and mothers generally do far better after a VBAC than a repeat cesarean section in terms of their mental health in the postpartum period. So there are great benefits to having a VBAC, especially when it is done safely, to both mum, baby, and the surrounding family. Because usually when mums have had a cesarean section, they do need help to either look after baby or someone to look after themselves, and those pose challenges of their own. As a midwife, when we look after mums who are going through a trial of labour after cesarean section, you find that there are great differences globally in how we manage that. Within the South African context, it's dependent on which provider you've chosen, whether you've gone with a gynae or whether you've gone with a midwife. It makes a difference whether you are birthing at a traditional maternity hospital or one of the more modern birthing centres that are usually more midwife-led. Those differences in care provider can actually increase or decrease your chances of having a successful VBAC. To come back to my role as a midwife during a trial of labour, my role is to monitor both mum and baby and the progress of the labour to ensure the safety thereof. And as an independent midwife, I usually provide my clients with one-on-one care. So from the moment mum goes into labour until she's given birth and even thereafter, I am solely responsible for her care. And you do very closely monitor every single contraction, every little kick, every little ache and pain that mum has, because those things can give you subtle clues as to the progress of labour. The ideal for a mum who is attempting a VBAC is to have a normal physiological labour with as little interventions as possible. This poses a big challenge when you are attempting to do a VBAC in a more traditional hospital, as you are then at risk of having routine interventions such as being catheterized or having an intravenous line. Also things like enema being shaved. Those types of routine interventions are incredibly unhelpful and often make mums more anxious than they should be, and that usually impacts greatly on the labour. When you are advocating for a normal physiological labour, you want mum to be able to eat and drink and rest as she pleases, and then when she then enters active labour, which is usually between 4 to 6 centimetres, it is different for each mum, to then be able to move around freely and assume a comfortable position to then aid that progress of labour. Especially when you are attempting a VBAC, because you are so limited in what interventions you can have and even what pain relief you can have, that would then greatly increase your chances to have a successful VBAC by being with a midwife, by having an active labour, by being closely monitored, because that also then greatly decreases your risks of having complications. Because most complications that women will experience during labour, whether it's your first baby or baby number 5, a lot of them have precursor or early signs that if closely monitored, you would already pick up on those signs. And as a midwife, we would manage them early. As I said, prevention is better than cure. But if you are not necessarily as closely monitored, like in a traditional maternity hospital, then some of those signs may be missed. And by the time they get picked up, you might already need more serious intervention more quickly than if we had prevented some of the more serious complications. So to conclude this discussion on a VBAC, I would leave you with my sage midwife advice, and that is to ask questions. Ask your care provider when they are planning to do a trial of labour or a caesarean section, what their reasoning is behind that. Often you find that in the South African context specifically, the decisions that are made do not necessarily have your wishes at heart for your birth, whether it's safe or not to do so. And as with any other operational procedure that you would have in your life, get a second opinion. If you are not happy with the answer of the first one, find out from someone else who may be more interested or more skilled and knowledgeable on this specific topic to give you the information and the answers that you need. We also find that within our community, families are not necessarily as supportive of partners or family members who are then attempting to have a VBAC, as everything you've ever heard about birth has mostly been quite negative. And actually during a person's VBAC journey, you need to have a lot of support, both from your partner as well as your care provider, whether that be a midwife or a gynae, and then also the surrounding family around you. That also impacts on the possible success of your VBAC. So if you are planning on having a vaginal birth, or even just attempting to have a vaginal birth after cesarean section, go out there, ask the hard-hitting questions, find the right care provider for you, so that you increase your chances of having a successful VBAC. So that's it for today. I'll see you guys in the next video. Bye!